Everybody, it's Geoff, and welcome to our Tuesday live stream. We have a special guest tonight, Ari Parker, the co-founder of Chapter, here to answer your Medicare questions. And of course, we have our producer, Jill, who is going to manage the questions for Ari and I. I'll handle the Social Security questions. Ari will handle the Medicare questions. And we will undoubtedly run up against time limits at the other end because thankfully you wrote in and gave us a lot of questions. So we're going to be answering questions both from the write-in and from those who put questions in the chat. Usual disclaimer, we haven't had the opportunity to interview you. Consider this live stream for educational purposes only. Seek out your own advice from a qualified professional before making any type of decisions. Speaking of qualified professionals, I'm going to put up the phone number for Chapter, our partner, our Medicare partner, and where Ari's from, so that if you have any questions about Medicare, you can give them a call. As a reminder, we're 3.5 weeks away from the end of the annual enrollment period. So time is ticking for those that want to talk to somebody about Medicare. Having said that,
happy Veterans Day.
And happy Veterans Day. Thank you. My dad's a veteran. Hi, Dad. And happy Veterans Day to you. I gave you a call earlier today to wish you a happy Veterans Day. And with that, let me pass over to Jill, who will lead the way.
Great. Thank you, Geoff. So do put your questions into the chat box. We definitely want to bring those in. But if you did email your questions in, of course, we will get to those for sure as well. So why don't we start with a question from the chat box since one came in right away. So that's great. And greetings, Andy. Thank you for the greetings. Laura is asking, if I move out of state during the first quarter of next year, can Chapter help me find a new plan in my new state? And will I be allowed to change because of the move?
Hi, Laura. The answer is yes. We can absolutely help you adjust your coverage once you move. You can even adjust your coverage 30 days before you move if you prefer. Alternatively, if you're moving like in January, let's say, it's something that we can look at now to make sure that your new coverage begins January 1st in the place that you intend to move to.
All right. Now, Fast Eddie is asking, how does medical work for people who are snowbirds?
So let's break it down. Let's step back and go to the stool, the three-legged stool. And I know we talk about this every week, but it helps provide a framework for what Medicare covers and what it doesn't. So the three-legged stool, first leg, your hospital coverage. The second leg is your outpatient coverage, everything outside the hospital. And then the third leg of the stool is your drug coverage. So hospital coverage, that's Medicare Part A. Outpatient coverage, Part B. And finally, drug coverage, Part D. D as in drugs. So if you just have original Medicare, which is Part A and Part B, then you owe 20% of your medical expenses out of pocket with no gap, with no ceiling on that 20%. So for example, if you get a knee replacement, that can be a $50,000 procedure. You would owe $10,000 out of pocket for your knee. And if anything else happens to you, that bill would just continue to pile on. You would owe 20% of all the other services you need. So that's why people consider some type of additional coverage. And here you have two options. Option one is Medicare Supplement, which is also known as Medigap. This is going to be the most comprehensive and flexible coverage. It's networkless. It allows you to see any doctor nationwide who accepts Medicare. And so if you're a snowbird, you would definitely want to consider Medicare Supplement. If you go with Medicare Supplement, the only other thing you would need is a standalone prescription drug plan, so that way you have your Part D covered. Option two is Medicare Advantage. Medicare Advantage is a replacement for original Medicare administered by a private insurance company, and it's managed care. It's subject to the private insurance company's terms and conditions, and it's subject to their network restrictions. So you have to make sure that each of your doctors is in network. Otherwise, you either can't see them or you'll pay more for coverage.
Thank you for that. Okay, so we are going to ask another Medicare question. Geoff, I think there's going to be more Medicare tonight than there will be Social Security as we round to the deadline for the open enrollment. Billy is asking, I'm 65, retiring at 67 and healthy. Can I start with a Medicare Advantage Part C plan to save money while I'm healthy, and then switch later to original Medicare with Parts A, B, and D, and a Medigap Plan G without having to move to an area where Advantage plans aren't offered?
So this person really gets it. The thing about Medicare Supplement is that in 46 states, you have a one-time opportunity to sign up for that coverage. And it's when you first turn 65. And it's called your Medigap Open Enrollment Right. So it's either when you first turn 65 or when you first start Medicare. So if you're coming off work provided coverage and you're 69 years old, don't worry, you're still in your Medigap Open Enrollment Right. But once you're outside that 6-month period, then in 46 states, a Medigap insurer can ask you questions about your health history. And if you have pre-existing conditions, then you might be declined. And something as common as diabetes and hypertension can be a reason you might not be able to obtain a Medigap plan. So the answer is it depends on where you live. And the best time to sign up for Medigap is when you first start Medicare, because that's when you're in your golden opportunity to sign up for coverage without any questions about your pre-existing conditions, and you can't be price discriminated against. Now, the questioner asks, can they switch from Medicare Advantage and sign up for a Medigap plan? And the answer is yes, and you can do it during the annual enrollment period. In 46 states, though, if you're outside your Medigap open enrollment period, then you may have to answer questions about your health history unless you have a guaranteed issue right, which those are few and far between.
All right, great. So now we have an emailed in question from Carolyn that says, my Medigap Plan G company usually tells me about next year's premiums only a few hours before the deadline to switch. Even if I research alternatives ahead of time, is that enough time to make a change?
We have pricing information from insurance companies that extends several months from now. In fact, for many, many carriers, we have pricing information that extends 6 months from now. So I would be very surprised to see a price increase that gets put on you at the stroke of midnight. That to me is quite surprising. And we'd be more than happy to tell you what we're seeing on our end in terms of what Medicare Supplement companies are charging you. And Medigap is standardized under federal law. So, for example, Medigap Plan Letter G is standardized. Each insurance company must cover the same hospital and medical benefits, regardless of the insurance company you choose. So what they're really competing on is price, and not just the current price, also how they raise price over time. And they're also competing on their credit worthiness and their branding and marketing.
Okay, so we are going to take a few questions as they're coming in fast and furiously in the chat box. Jean is asking, how early should I file for Medicare? I turned 65 in May.
The earliest that you can file for Medicare would be February, unless you're born on May 1st. If you're born on May 1st, then it moves your window up a month. So February is the earliest that you can do something. And it takes less than 5 minutes to apply online to activate your Medicare. Do it through your online Social Security account portal. It's fast, safe, and secure.
Okay, great. Geoff, there's a Social Security question coming in for you from Jean. It says, hi, Geoff, I'm confused. I just watched your Social Security income for 2026 video. Did I misunderstand? I can make $40,000 at age 65, and then when I turned 65, I can only make $24,000 more in the same year?
So the question, it relates to income, earned income limits. And that's probably the one that you saw I literally posted at 6 o'clock today. So for those of you who haven't seen it, don't stop watching us here. But when you're done here, there's an excellent video about income earnings limits for 2026. So if you if you are working and you claim Social Security, you have basically two different scenarios. Scenario number one is this isn't your full retirement age year, and in 2026, full retirement age is age 67, or it is your full retirement age year, but you haven't reached full retirement age yet. If this isn't your full retirement age year, you can earn, and you're taking Social Security, you can earn a total of $24,480 per year before you have to give any of your Social Security payment back. Anything in excess of that, you have to give back $1 for every $2 over that limit. If this is your full retirement age year, i.e. in 2026, you reach 67, but you haven't reached 67 yet, you can earn up to $65,160, and then you have to give $1 back for every $3. Now, these numbers are great if this is year 2, year 3, or year 4, but what happens if you are in year 1, you've just retired, you've just started claiming Social Security, and it is in, say, 2/3 of the way through the year, let's call it August or September, and you've already earned, I think in the video I used an example of about $73,000. That's 3 times the limit. Does that mean that you have to give everything back to the Social Security Administration? No. What happens is you can earn as much as you want up until you start receiving Social Security. And then once you start receiving Social Security, that annual limit for the first calendar year only, and that could be 3 months, 4 months, 5 months, it could be 9 months or 12 months if you retire on January 1st, has turned into a monthly limit. And so you just divide the $24,480 by 12, and that's your monthly amount. Anything in excess of your monthly amount, you have to give back $1 for every $2 over the monthly amount. And the same thing for the annual limit, or the FRA limit of 65,160 divided by 12. And as long as you are earning in excess of that per month, then you're fine. If one month you earn more than that and another month you don't, the month that you earn more than that, you have to give $1 back for every 2 or 3 respectively, depending on your age.
All right, great. Thank you for that one. Marion is asking a Medicare question. How can I calculate how much I'll pay for Medicare Part B? I'm retiring in February and will transition to Medicare A and B on March 1st, 2026. I earn over $100,000 gross annually.
We are still waiting for the government to announce the Medicare Part B premium for 2026. There have been projected estimates that have been posted online, and you'll see them in the blogosphere, but we haven't seen a number yet. That should come shortly. It should have been announced October 15th. I'm sorry that the government didn't do that. They missed their own deadline, but we should see the Part B premium announced soon for 2026. As a baseline, let's use this year's numbers. So if you're a solo filer and you earn less than $106,000 modified adjusted gross income, then you owe the standard amount for Medicare Part B, which is $185 per month. What you get in return for that is 80/20 coinsurance. So the government picks up 80% of your medical expenses and you owe 20% out of pocket. In order to cover the other 20%, you have 2 options. You can choose Medicare Supplement, or you can choose a Medicare Advantage plan. It's one or the other. They're mutually exclusive. And the cost will vary depending on the state you live in. In some states, Medicare Supplement may only cost about $100 to $125 per month if you're 65. It'll cost more if you're starting Medicare and past age 65. It also can vary based on your tobacco status, your marital status, and whether you even have a roommate, because for some insurance companies, that qualifies you for a household discount. On the other hand, Medicare Advantage, what people like about Medicare Advantage is that most of the plans have a $0 premium and come bundled with drug coverage. But there are trade-offs. With Medicare Advantage, all of your providers need to be in network, otherwise you'll pay more. Medicare Advantage is also subject to a private insurance company's terms and conditions. So here's where we get into the world of prior authorizations. And there were over 50 million prior authorization requests in 2023 alone.
Wow. All right, Scott, thank you for your emailed question. On original Medicare, it seems that Medigap supplement premiums vary by state and by provider. Do I need to shop these plans every year myself, or will Chapter review my coverage annually and notify me if they find a better priced option?
That's exactly what we do. We'll help you shop your coverage and see if there's a more affordable option for you. You don't have to wait. You can shop your Medicare supplement at any time. It'll be a question of whether you can qualify for that lower price. In 46 states, an insurance company may get to ask you questions about your recent health history. Now, there are about a dozen states that have established birthday or anniversary rules that allow you to change your policy without any questions about your health history. So it just depends on where you live, but that's absolutely something that we can help you with. And we're also proactive about it. If we notice that your premium is spiking, then we'll proactively reach out to you and help you see if you may qualify for a lower priced plan that offers the same coverage.
All right, a Social Security question, Geoff. Here we go from Keith. I'm retiring in April and will earn about $28,000 before I retire. Since I'm claiming Social Security at 62, does that earnings limit apply to money I earned earlier in the year, or does the $23,400 limit only apply from the month I start taking benefits?
Hi, Keith. So this is similar to the question that came through in the chat. And anything you earn up until you start receiving Social Security doesn't count. So the limit, the $23,400 limit, that's a 2025 number. 2026, it's $24,480, which is $2,040 per month. And so up until April, you're good. Anything from April onwards, once you start receiving Social Security, first year only, you can't earn more than $2,040 per month, and without having to give part of it back. Anything in excess of that, $2, for every $2 you go over that, you have to give $1 back to the SSA. You get it all back once you reach full retirement age. It effectively goes back into your Social Security account, and your payment at full retirement age just gets recalculated.
All right, Ed is asking, Ed Rock, in the chat box, for you, Ari, I noticed I can select a Part D plan on the Medicare site. Is this common? I started with another advisor, but do not meet for a few weeks.
Yes, you can absolutely review your prescription drug coverage through Medicare.gov. Just enter in your prescriptions, choose your pharmacy, and see which plan is the right one for you. They vary zip code by zip code across the United States.
All right, great. So LS Price is asking, soon to be retired, what percentage of a retired person's income is usually spent on healthcare insurance? Looking at the numbers now, it looks like it will consume a high part of my income.
So the average couple turning 65 will spend about $315,000 on their healthcare costs in retirement. Now, as a percentage of your assets or your income, I'm not sure what that amounts to, but that's a very large number. So it's important to get it right.
All right, a Social Security question for Geoff. Doug is asking, most analyses that favor claiming at 70 instead of 62 seem to assume your retirement savings won't earn anything between age 62 and 70. If your investments earn 6 to 7%, the math appears to favor claiming at 62, especially with the potential benefit cut around 2032. If you already have savings, why not take Social Security at 62? What am I missing?
So there are a couple of things. It's a pretty big assumption that Social Security is going to be cut in 2033. I think, and I've said this on the channel before, I think that our politicians will come together on this and fix that, just like they have a dozen times in the past with various major amendments to the Social Security Act. But beyond that, when people think about the return on their Social Security payment, or the return that they receive by waiting, the increase, they're comparing not just an increase to one particular year. You're comparing the increase for all years going forward. So 20 years, 30 years, 40 years out, versus taking Social Security at age 62 versus age 67 or age 70. And that's a much smaller slice, and then investing that. That's the first thing. The second is that there's this concept that almost everybody forgets about, and that's called risk. And risk is real in the markets. I was a banker for 25 years, and I can tell you the first thing that bankers do when they're assessing investing in anything is they don't look at the return, they look at the risk. If you go to Las Vegas and you have a 50-50 chance of doubling your money, well, that's a great return, but you have a 50% chance of losing your money as well. And that's an extreme example, but the point is that when you're assessing the argument, I'm gonna take Social Security at age 62 and invest it, you have to understand risk. And also, unless you have a pension, you're going to be investing your money into, say, a 401k or an IRA, but you're going to be withdrawing money from somewhere to fund your life. And so in essence, you may be robbing Peter to pay Paul, or some other variation of that. So this is something that really goes into a lot more detail than anybody can do on a spreadsheet. You need Monte Carlo simulations and a lot of really good data to back this decision. And it's something that most people, a lot of people, come to the conclusion that if it's just about maximizing dollars, then it makes more sense to wait. Now, there are other reasons to do it. You might just need the money, you meaning people. And that's a legitimate reason. Life's been hard. You need the funds now because you need to pay your bills. Or you might be trying to optimize for a certain point of your time when you're younger and you have more energy, and so therefore you want to spend more. Or you want to wait longer because you might be optimizing for the survivor benefit. There are so many options that you need to think about with this question. Unfortunately, there isn't one right answer. The mathematical answer really depends on what you invest in, what the risk is, and what your life priorities are.
All right. Next question is Medicare, that came in from email, which is from Michael. Does Medicare provide any coverage for dental procedures? If so, how does that coverage differ between a Medigap supplement plan and a Medicare Advantage plan?
There's no coverage under original Medicare for dental, vision, or hearing. So your Medigap plan wouldn't cover dental, vision, or hearing either. So these are the types of benefits that Medicare Advantage insurance companies frequently advertise to you. What they're talking about are the additional goodies like dental, vision, or hearing. But it's not worth sacrificing your providers, your prescriptions, or your priorities in order to get a couple $1,000s of dental. So you have to weigh the trade-offs.
Okay, Donnie is asking, I have a two-part question about Medigap Plan F. I was born in 1957 and have been on Medicare Parts A and B since 2015 due to disability. And I've also had coverage through my husband's employer for the past 7 years. Since I turned 65 in 2022, after Plan F closed to new enrollees, do I still qualify for Plan F? I'll stop there and then we can keep going on her question.
So because you turned 65 after January 2020, you actually should be eligible by way of guaranteed issue for Medigap Plan G. And that's great, actually. Let me explain the difference between Plan F and Plan G. They're identical except for one thing, and that is Medigap Plan F covers the Part B annual deductible, which is $257 for this year, whereas Plan G does not. With that said, oftentimes the premium for Medigap Plan G is your savings are much greater than that $257 deductible. So on net, you do better on a Plan G than on a Plan F once you account for owing that Part B deductible, which Plan F covers, but Plan G does not. They're otherwise identical.
Okay, so her second part is my husband just retired on October 23rd, 2025 at age 71. He turned 65 in 2019, but didn't enroll in Part B until now. Because he was eligible for Medicare before 2020, does he still qualify for Plan F?
Yes, he would still qualify for Plan F, but again, want to go back to whether it might be more desirable to be on Plan G. And that's something that a Medicare advisor could walk you through. Make sure you work with someone who's independent, unbiased, and has every insurance company and every plan offering at the touch of their fingertips.
Okay, and Mark is asking, Medicare bases IRMAA surcharges on income from 2 years prior. If your income has since dropped due to a qualifying life change, how do you request an adjustment to reduce your IRMAA?
You use Social Security Form 44 and you fax it to your local Social Security office, or you send it by certified mail. And this is something that our team would be more than happy to help you with.
Okay, great. Geoff, a Social Security question. Marcus is asking, there's a few coming in now. I retired in June 2024 and started collecting Social Security in July 2024. However, my 2024 final year of retirement was one of my top 35 years. When can I expect Social Security to recalculate my monthly payment?
So Social Security doesn't recalculate your monthly payment every month. At the end of every year, they'll look at your best 35 years and recalculate it then. And to be candid, the SSA and a lot of their systems were and still are from the early 2000s. A lot of their computer hardware is from the early 2000s, even the late 90s. And so I've heard stories of people that have had their Social Security benefit recalculated 24 months later, and then a catch-up payment was made to them. So you won't lose it. They're not going to not give it to you, but there's a combination of staffing issues right now and also antiquated computer systems. And I think they're trying to modernize the SSA. In fact, I know they are, but that's any type of computer modernization, whether you're talking about a company or the government, is going to take a little bit of time. So just hang in there. It'll happen.
Okay. Linda has a Medicare question. What if I have a qualifying insurance through my husband? He is 60 and I am 65. Can I choose Medigap in 5 years without a physical?
Absolutely. So your Medigap open enrollment right will coincide with when you start Medicare in 5 years.
Okay. Brian Fly Fisherman Dish is asking, what is the average cost of Medicare for a single person?
With a supplemental. So Brian, this will depend on what state you're in. So there are a few states where supplements cost an arm and a leg. They are primarily along the they're primarily on the East Coast, and they are New York, Connecticut, Massachusetts, and Maine. And the reason Medicare supplement is so expensive in those 4 states is because those are the states that allow you to choose Medicare supplement without questions about your health history. There are a couple other states where Medicare supplement is also quite pricey. Examples would be Washington State and also South Florida. Those are another 2 places where Medicare supplement can be expensive. Now, there are states where Medicare supplement is exceptionally affordable. Indiana, Iowa, South Carolina, and the list goes on. So it really depends on where you live as to what your cost will be. And this is something that we would be more than happy to help you project.
Okay. There's a Social Security question from Big K, Third Coast Reds. And it seems to be an add-on to Keith's question, and Big K might be Keith. So Big K, if you are Keith, you can let us know. But he came in the middle of when you were asking it, and I believe it was an earnings limit question. And he just said, came in at the end of explaining what gets paid back. Wife will make the $24K next month. She's 63 now, but started collecting Social Security at 62. So question is, will the post be online later? Or if you want to continue answering it now.
So I'll answer the question now because I think what you're asking is when she started taking Social Security at age 62, she was on the first year provision. She was not exceeding the monthly, or maybe she was and had to get part of it back, but she was measured monthly, not annually. And in 2025, she is now measured on an annual basis, and frankly, going forward, measured on an annual basis. And so if your wife is going to exceed the annual limit, I highly recommend that you talk to the SSA and have them reduce or suspend your Social Security payment. The reason is they won't catch it right away. If the minute you cross that threshold, you're not going to get an email or a phone call from the SSA saying, hey, we understand you just crossed that line. You might not get that email or phone call, and frankly, probably would never get a phone call, an email or a letter from the SSA for 2 or 3 years. And the number will be huge if it's 3 years in many cases. So if you're going to exceed the limits, give them a call, ask them to pause or reduce your Social Security payment. Big K.
All right. Thank you. All right. Ruth is asking a Medicare question. How can there be a 0 premium Medicare Advantage plan? What is the catch?
This is an awesome question. Thank you so much for asking it, Ruth. You still owe your Part B premium when you sign up for that $0 Medicare Advantage plan. The government then pays the Medicare Advantage insurer of your choosing to administer your Medicare benefits. So you're now subject to that private insurance company's terms and conditions. The government is protected because the insurance company has the upside and they also have the downside if you have a lot of medical and healthcare expenses. So that's how the system works. The government is paying the Medicare Advantage insurer of your choosing to administer your hospital, medical, and drug benefits.
Okay, so Brian had asked about what's the average cost of Medicare for a single person. He also now is asking what's the average cost of Medicare with supplemental for a single person.
Yeah, that's the question that I hit on a few moments ago.
Oh, okay. All right, so let's move to Steve Cousins has a Social Security question. My wife and I will draw a combined $83,500 in Social Security starting next month as I turn 70 on December 1st. Who knew Social Security pays out so much? Paid the max every working year. Is there a question there?
So congratulations, you probably are in that top 1% of Social Security recipients, and that comes about by waiting and by earning a reasonable or extremely large amount of income over a 35-year period. So, but the number you're talking about either puts you at or close to the maximum.
Okay. Lots of conversation in this chat box as well. All right. So a Medicare question coming in from email from Tim. I turned 65 this December. And I'm still working for a large employer with good health coverage. I plan to retire at 67. I know I can delay Medicare, but I've been told I should enroll now anyway. Is it better to enroll at 65 or wait until I retire? If I delay, can I add Part B or Part D later without penalties or gaps? And since my wife is 67, retired and covered under my employer plan, does she also need to enroll now, or can she wait until I retire and our employer coverage ends?
There's nothing that you need to do right now. Instead, in 2 years, when you're ready to retire, that's when you and your spouse will activate your Medicare and then choose the additional coverage that you'd like to have, whether that's Medicare Supplement and a standalone drug plan or a Medicare Advantage plan. So there's nothing that you need to do now. And the reason why is because you're covered by a large group employer. Rule of 20. If your employer has 20 or more employees, you can delay starting Medicare. That is the only exception for delaying Medicare.
Okay, great. So now we have Mark asking, my wife and I currently have Medigap Plan G in Pennsylvania, but we're moving permanently to Florida next year. I've heard that Florida's supplemental plan premiums are higher than Pennsylvania's. Will our Plan G premiums increase because of the move? And when would that change take effect? If our current carrier doesn't operate in Florida, can we switch to another carrier offering Plan B without going through medical underwriting? And if we find a lower cost Plan G carrier in Florida, are we allowed to switch?
A lot of parts to this question. Your Medicare supplement insurance is portable. You can take it from Pennsylvania to Florida. Now, many Medicare supplement insurers will reprice you to the out-of-state rate. So your premium will likely go up as a result of moving from Pennsylvania to Florida, but don't worry, you can still keep the insurance that you have. Now, if you're healthy enough to qualify for a lower priced Medicare supplement, then it's certainly worth something considering, and that would just depend on your health.
All right, Maria is asking, I will be 65 next February and I'm still working. Do I still have to sign up for Medicare?
No, as long as you or a spouse work for an employer with 20 employees or more.
All right, Geoff, Buzz is asking you, do I need to file for Social Security when 62, even if I do not plan to take it until I turn at least 65?
No, you don't. And in fact, you are only allowed to sign up 4 months ahead of time. And I would recommend if you were turning 65 or 67, whatever age you decide to take Social Security, to use the full 4 months, simply because there are, right now anyway, there are delays in a lot of things, and who knows what the future holds. But you don't want to, and you shouldn't even think about signing up for Social Security until it's basically time to sign up for Social Security. 4 months.
Okay, Chris is asking a Medicare question. For retired federal employees who have both FEHB and Medicare, which program pays first? And once Medicare is added, does it affect access to the full range of FEHB benefits or limit the choice of medical providers?
So Medicare pays first and your FEHB is secondary. And no, you shouldn't be restricted to any providers because you have the opportunity. Many federal retirees love their FEHB insurance. It's about 50-50 whether they also choose to add Medicare to take Part B, that is. And so you really shouldn't be restricted because Medicare is networkless insurance. You can see any doctor who accepts Medicare nationwide, and almost every provider and institution do.
Okay, Michael is asking, if I get a Medicare supplement plan living in South Dakota and then move to another state, will I need to get a new supplement when I move?
No, same thing applies as the previous questioner who's moving with their Medicare supplement plan. It's portable insurance.
Okay, Stargazer 2020 is asking, I pay into an HSA. Does Medicare count 6 months back for contributions when you start Medicare or when you apply? Heard both. Plan to start A in October while working and retire January of 2027.
It's from the month you apply for the purpose of when your Part A begins. This is the trickiest rule that the Social Security Administration has on the books as it relates to Medicare. It's from when you apply for the purpose of backdating your Part A. Now, health savings accounts are amazing. They're an incredible retirement savings vehicle. So it sounds like you're contributing to an HSA. So I would ask, why are you planning to enroll in Part A now when you're still planning to work for another 14 months? If I were in your position, I would wait until December of 2026 to apply for Medicare. So that way I can continue to make contributions to my HSA account.
Okay, Steve is asking, can I this is a Social Security question. Oop, it just moved. Can I either switch to Social Security Survivor from CPP survivor at 60, now 58, late wife, had only 2 years of Social Security before becoming sick, never collected past at 70 years. Canada is 1/3 of USD.
Yep. So I don't know a lot about the Canadian Social Security rules, so I really can't give you an answer on anything related to Canada. I will say that survivor benefit is in the U.S. is one of the most flexible benefits that Social Security has to offer, and usually when Social Security has a provision where you take something early or you make a decision on that benefits you, you're giving up something. The survivor benefit, I've often said, I don't know who thought of the rules around the survivor benefit. I can imagine that there was probably several politicians sitting in a room one time, and somebody had a melancholy moment and said, you know what, I know that situation. Let's actually nudge up instead of nudge down. And so survivor benefit, there are a lot of rules that are less restrictive. I do have a video on the survivor benefit in the catalog on YouTube. There are 450 plus videos on there. I think the number is now. So just go to YouTube and just type in survivor benefit, and you'll know what the rules are as it relates to the U.S.
All right, a Medicare question from Scoutmaster. My company retired me in 2024 with a severance that increased my yearly income for 1 year. What can I do to minimize IRMAA?
If your Medicare didn't start until 2025, then the government would be looking, it's a 2-year look back. So for 2025, they'd be looking at your 2023 return. And for next year, that's when they'll look at your 2024 return because it's a 2-year look back. So if you've had a life-changing event and work stoppage or work retirement, those are the top two in order to appeal, you would simply fill out Form 44, list your income for 2025 or even your anticipated income for 2026, since we're already at the end of the year. And then you would send it back to Social Security. You can fax it. You can send it by certified mail. You can drop it off in person. And then they should respond within 4 to 6 weeks. And hopefully you get that IRMAA lowered.
Okay, another Medicare question from Bert. I retired this June and also received a one-time inheritance that same month. I've been paying an IRMAA surcharge since becoming Medicare eligible in June 2025. Now that my work income has ended and the inheritance was a one-time event, I'm eligible to request an IRMAA reduction. And if so, when should I apply?
So a one-time inheritance, that's not one of the life-changing events for the purpose of appealing IRMAA. There are 8 life-changing events that the Social Security Administration spells out on Form 44: work stoppage, work reduction, divorce, marriage, the list goes on. There are 8 in total. But you should know that cap gains or an inheritance or the sale of a secondary residence, let's say, those all would count for the purpose of calculating your modified adjusted gross income. So the good news is that it'll auto-correct downwards after the year is up. And if you have one of those 8 life-changing events, you can certainly appeal if it would produce a material change in what income you would have shown to the government.
Okay, Lisa's asking, in 2026, I will be paying about $257 a month for my supplemental J. Live in California, but the coverage is great and can go anywhere in California or anywhere in the US and 3 months coverage overseas. Is this too much?
So Medicare Supplement Plan J, Medicare Supplement Plan J is a rare bird. That coverage, that is from 15 to 20 years ago. So we're really playing Medicare history here. That is fantastic, Lisa. I would need to know a little bit more about your situation to tell you whether that's a fair price, but just spitballing with you here, it sounds quite reasonable. Again, I would need to know your date of birth, when you started Medicare Part B, whether there's another person in your household, whether you use tobacco, but I would hold on to that if I were in your position. I think that seems pretty reasonable, just giving you my 2 cents here and now. But again, I would want to check our platform, which has all the pricing information, just to be sure.
Okay. Studio Stu is asking Geoff a Social Security question. My wife and I are still working. We took Social Security at 70 and 68. We're now 72 and 70. We have Kaiser and have been told since my wife is covered. Oh, this is a Medicare question.
Hey, Jill.
Yes.
You can't really mention insurance company names. It's just really not a good idea.
Oh, you're right. Okay. We'll move on from there.
Don't worry at all. Also, Lisa put in a correction. She actually has Plan N rather than Plan J. So $257 for Plan N. That might be high depending on your date of birth and when you started Medicare Part B. So I would certainly want to just get a comparison. I'll also note that you mentioned you live in California. California has a birthday rule that starts on your birthday, and that allows you to change to a lower price Medicare supplement plan or a lower Medigap plan letter type. So that would be another way in which you could save money. Okay,
Cindy is asking a Social Security question. How long do we have to be married in order for my wife to collect 50% of my Social Security benefit? We're not yet married. She's 65. I'm 68. I'm waiting until 70 to start.
So for the spousal benefit, you have to be married 1 year. For the survivor benefit, you have to be married for 9 months. There are exceptions to this. The exceptions are common children and one or two others, but for the purposes of what you're talking about, more than likely you're talking about 1 year.
Okay. Let's see. Did we ask this question? All right. We're going back to, where is our Medicare questions? One that came in through email. It's Greg. I'm 69, still working full-time and covered by my employer's health plan, about 400 employees. I'd planned to transition to Medicare now, but with the upcoming Medicare cost increases, should I wait until I retire next year instead? The cost comparison between my current coverage and Medicare is very close. What's the smarter timing in this situation?
It's great that you've already performed an apples to apples comparison between your work provided coverage and what you would receive with Medicare. I think where the rubber meets the road will depend on your healthcare utilization, how often you plan to go to the doctor, whether you have any pending surgeries. What people fail to appreciate is that Medicare is excellent health insurance. It allows you to go to any doctor nationwide who accepts Medicare. And the deductible for this year was only $257. If you choose a Medicare supplement plan, that would also be your maximum out of pocket under the most comprehensive Medigap plan letter types, for example, plan letter G. So it's really going to depend on how much healthcare you're planning to use next year. That type of apples to apples comparison is something my team would be more than delighted to help you with and to work through the numbers with you.
Okay, great. Another Social Security question from Steven. My wife and I both have Medigap Plan G. We live in Michigan and are 69 and 70 and in good health. Many of our family and friends are on Medicare Advantage with no premiums and lots of added benefits. Should we consider switching to an Advantage plan? And during this time of year, can we change without going through medical underwriting or a physical exam?
The answer is yes. You can drop your Medigap plan and go to Medicare Advantage. This would be the time to do it. You have until December 7th. With that said, I hardly see it happen. And the reason why is because of the 3P framework. The 3Ps are your providers, what doctors you want to see, what institutions you want to go to, probably not the same as your neighbors. The second is your prescriptions, what medications you take, what pharmacy you like to go to. This could be an area in which Medicare Advantage, because it's bundled coverage, might have savings for you. But if you're on expensive prescriptions and you change to a Medicare Advantage plan, then you might not be able to get your Medicare supplement back unless you do it within 1 year from having changed. The third and final P, I think, is the most important one for you, and that's your priorities. Do you love to travel? If you love to travel, then you don't want to be subject to network conditions. Are you a snowbird who spends winters in Florida or Arizona? If you plan to see doctors in either of those states, you probably want to find yourself on a Medicare supplement plan so you're not subject to network conditions. Same thing applies if you own an RV, a motorcycle. If you plan to travel internationally, many Medigap plan letter types have an 80% international benefit when you travel abroad for the first 60 days that you're outside the United States. And so this can go a long way towards helping you save on your international, if something were to happen to you while you're overseas. And just to tell you a quick story, we had a client last summer who was vacationing in France, and they suffered a heart condition. They were hospitalized in Paris for nearly 2 weeks. They racked up $30,000 in hospital expenses. Because they had Medigap Plan G, our member advocate team was able to help them get $24,000 in reimbursement. Now, this foreign travel benefit under Medigap is subject to a $50,000 lifetime limit, but that goes a long way even in Western Europe. So that's also something to keep in the back of your mind.
Wow, that's really interesting. Great story. All right. Question for you, Geoff, from Jay. My question is regarding survival spouse benefits. My Social Security will be about $5,000 per month. My wife's Social Security will be about $1,400. If something happens to me, what would be my wife's benefit?
So the survivor benefit it's a two-part benefit. Part one is basically your wife will receive the $5,000 per month, provided that she files at her own full retirement age. That's part two. In fact, it's not a complicated calculation, but it is one that you really need to know. And that is, when you file for your own benefit, you can file at full retirement age and you get 100%. You can file 3 years later at age 70, you get 124%. Or you can file as early as age 62 and you get 70% of your full retirement age benefit. Those numbers are important because that's the starting point for the survivor benefit. Your wife, if she files for the survivor benefit at her own full retirement age, it's basically 100% times whatever your benefit was at the age that you filed. So if you filed at 65, well, then your benefit is going to be 86.66%, and your wife will get 86.66%. But if she's younger, then that will be reduced by her filing age. So the answer is she'll get the larger of the two for sure, but also, and really importantly, if your wife has her own benefit, she can let one grow and have and claim the other, but you can't let the survivor benefit grow to more than 100%, whereas her own full Social Security payment she can let grow to 124%. But given the numbers you're talking about, with the spousal benefit being $1,400, it's unlikely that she will reach a point where she gets anywhere near the $5,000 that you're talking about.
All right. Paul is asking a Medicare question. On Veterans Day, he is a military retiree. I find it difficult to sort through the details of TRICARE for Life. On the surface, TRICARE for Life combined with basic Medicare seems like the best option because it covers Part D and fills the deductibles left over from Medicare. In your experience, is that truly the best setup, or are there hidden downsides I should be aware of?
It's absolutely the best setup. And thank you for your service. TRICARE for Life is for retired service members, meaning this viewer served our country for 20 years and retired with the military. TRICARE for Life is a $0 Medicare supplement plan. The only thing that you need to do is sign up for Medicare Part B, and then you also get excellent prescription drug coverage as well. You are all set. You don't need to do anything else.
All right. As we are running up against the clock, there are a few more Medicare questions. We're going to try to slide right in there. DF is asking, I'm 66 and retired, but I'm covered under my wife's employer health plan, which includes medical, dental, and vision. Am I required to enroll in Medicare now, or can I wait until her coverage ends without facing penalties or gaps?
You can wait until the coverage ends as long as your wife, your spouse, works for an employer with 20 or more employees. Rule of 20.
All right, great. And Tom is asking, I'm 65, collecting Social Security and already enrolled in Medicare. My wife's still working for a large company and I'm covered under her employer plan. When she retires and that coverage ends, what steps do I need to take to make sure I have the correct Medicare coverage in place?
So all you need to do is a month or two before your spouse is ready to sign off from the work provided coverage is activate your Medicare Part B. You already have a Medicare number because you're taking Social Security. So you have a red, white, and blue card that says Part A only, and you'll activate Part B a month or two before your spouse is ready to retire. That'll also be the time to sign up for the additional coverage of your choosing, whether that's Medicare supplement and a standalone drug plan or a Medicare Advantage plan. So nothing you need to do right now.
Understand how the benefit structure works. Now, there are children's benefits with Social Security, and perhaps that would be something to look into. I need more information on your specific situation in order to give you a clear steer on which way to go here.
Okay. Let's see. I think we have one more Social Security question. I know we're running up against the clock. So this one seems like a quick one. Can you explain the spousal 50% increase? My Social Security will be $5,000 and my spouse's Social Security will be $1,500.
Yep. So the spousal benefit's based on your Social Security payment at your own full retirement age, even if you don't take it at full retirement age. If you take it at 62, 63, 64, doesn't matter. It depends on the age of the spouse. If the spouse reaches his or her full retirement age, then they get 50% of the primary insured's benefit.
All right, great. Lots of gratitude coming in. Thank you so much for all of your brilliance, both of you. Everyone's saying thank you so much. So Geoff, I'm going to turn it back to you to close us out. Thank you all for all your questions. These were great questions.
So first of all, thank you, Ari, for joining us here. We are coming to the, not the end, but we're getting closer to the end of the annual enrollment period. So it's really appreciated that you come on with us and talk about questions, because a lot of people have a lot of questions. So first, let me thank Ari for coming on with us. Now, gang, we are 3.5 weeks away from the end of the annual enrollment period. If you have questions, give our partner at Chapter a call at 440-703-1224 to see if they can help you with those questions. They're there to help and exceptional at what they do. I also want to thank Jill for doing her usual great job as a producer of this show. Thank you, Jill, for steering us through the 60 minutes of Q&A. We couldn't do it without you. And thank you, everybody in the audience, for staying up to watch us. We will be here again next Tuesday answering more questions about Medicare and Social Security. But if you have any questions, send them to livestream@holyschmidt.com, and that will get those put in early. And it helps us because we can actually build out a question list like we do every single week here. One final point, something I've been hinting at for a long time now, it is here. I have the personal assessment, your personal financial assessment. Go to holyschmidt.com/quiz. It's 15 questions, takes you 2 minutes, and you will have a full report emailed to you instantly. So holyschmidt.com/quiz. With that, enough of the shameless self-promotion. I think it's probably a good place to end. Thanks, gang, and we will see you next week. Bye, everyone.